Today I'd like to talk to you about a procedure which is called thrombectomy. This is a procedure that we do on stroke patients when they come to the hospital urgently with some acute stroke symptoms. Just like you can probably see on this case, when we inject the patient's right carotid artery, the whole right brain should show up with contrast. It doesn't, because there is a blockage right there. The right middle cerebral artery is blocked by a blood clot. We call it embolus, that traveled up there with the bloodstream, probably from the heart. And now it wedged into this artery, and the artery is unable to fulfill its task to supply the right cerebral hemisphere with blood. The blood flow to this area depicted with the red color, the blood flow is very much decreased, and this is either because too much time has passed since the onset of the symptoms, or the patient's anatomy doesn't supply this brain territory with sufficient so-called collateral flow that would make it possible to survive for that brain territory for an additional few hours until help arrives. Fortunately, in such cases, 10, 15 years ago, some devices were invented which are able to reach those areas of the brain, and they can treat the large vessel occlusions. We went up with a catheter and ended up with complete reopening of that blood vessel, and now you see that the right hemisphere receives sufficient amount of blood, and the patient neurologically improved by the next day. The patient was back to normal. Sometimes the blood clot is really small and it arrives not in these large vessels, but what if it travels longer, it travels far beyond this, and it reaches somewhere in this blood vessel out on the periphery. These large catheters that we had 10-15 years ago were unable to reach that portion of the brain vascular system. But today, with the improvement of the technology and developing smaller and even smaller devices, today we are able to reach those territories. I'm going to show you one of these cases where one of these really small catheters is advanced safely far up to the brain vasculature, and with the next move, turning on aspiration, just like a vacuum cleaner, it grabs that blood clot wedged there in a peripheral vessel and then brings it out. So the case I just previously showed you, going with the small catheter into that very far vessel, the patient is otherwise very good clinical and neurological status, and suddenly developed a complete arrest of his speech. As we say, he was aphasic. This type of problem in the past, I would say not even 2-3 years ago, we weren't able to solve with high certainty. However, today, with those small catheters specifically developed to reach these small brain arteries and these territories, specifically, I think, involving the speech area, we can get there, we can remove these blood clots, and we can restore the patient's ability to talk, to understand others, to communicate. The neurointerventional team at Holy Cross Hospital is spearheading these research efforts, these new procedures, and now we make it widely available in the Fort Lauderdale area.